Hi, everybody. My name is Jenny Martin. I'm with the OJA Mobile Assessment Team. And for any of you that may not know what that is, I meet with one or two kids a week to conduct their mental health evaluations. There's a big group of us that go out and do that. Some of the kids we work with are already in OJA custody, while some of them are still going through the court process. So I chose to develop this training on self-care right around the time that COVID hit because I wasn't allowed to see kids anymore. And I thought that it is really important that we all have the tools and knowledge to effectively take care of ourselves physically and mentally. So during this time, we're all facing some challenges that can make it especially difficult to not only take care of ourselves in our work environment, but our home and our community as well. So uh, to start things off, I wanted to make sure that everybody knows that self-care can be an effective way for us to manage stress and its negative effects, but it's not a replacement for treatment of mental illness. If you or anyone you know are having thoughts of harming themselves, then it's important that appropriate action be taken. I've included these two phone numbers on here, the Suicide Prevention Lifeline and COPES, which is a Family and Children's Services organization. It stands for Community Outreach Psychiatric Emergency Services. So pretty much anybody can call both of these numbers, but COPES has a group that may actually go out in Tulsa County and respond to a particularly stressful situation. If any of you do not have these phone numbers saved in your phone, I highly recommend that you do. It's a good resource to have. And to get things started, I want to ask everybody to take about 15 seconds, just reflect on your day so far. All right, and now think about the rest of your day. What do you have planned after you watch your streaming? So were you guys thinking about all of your chores or responsibilities like cooking, cleaning, doing laundry, something like that? And did anybody take the time to think about taking care of themselves today? It's really not uncommon for us to completely neglect our mental and physical well-being to take care of our responsibilities. And I really hope that everybody can take something away from this training that might help you in your personal self-care practices. So let's talk about why it's important to take care of ourselves. The primary goal is to effectively manage stress. Stress happens to everyone. It's a completely normal part of life. But if we're not successfully managing it, it can be detrimental to our well-being. It also affects how we view ourselves and our relationship with others. According to the American Psychological Association, a physiological stress response occurs when we perceive a situation to be challenging, threatening, or uncontrollable. So here's an example of what happens whenever we experience a stress response. So the external stimuli that is seen as threatening, and the fight or flight or freeze response is initiated, which causes the stress hormone that you can see on there to release and to make our cause physiological changes in our body. The result is increased breathing, heart rate, and sweating. And stress hormones can also cause a spike in blood pressure and increase blood flow to our skeletal muscles. So if you've heard of an ordinary person lifting a car to save someone trapped underneath it, this is what's going on in their body when that happens. I actually just experienced this recently. I'm sure everyone has also had the experience, but my most recent example was whenever I was going for a walk just down the street from my house. I was with my husband and my 2-year-old son in the stroller, and we did this almost every day, so nothing out of the ordinary. And as we were walking, we saw this dog that we thought we recognized. It's a chocolate lab that lives just down the street. And we weren't worried about it or anything. He usually comes up and walks with us or follows us for a little while. And so we just didn't think anything of it. But as we got closer, we realized that this was not the dog that lives down the street. And he looked kind of rabid. He was foaming at the mouth. And whenever he got a little close to us, he had an aggressive stance. And I knew that was a bad sign. I remember feeling those stress hormones kick in and immediately just going into flight mode, trying to get my son away from this dog. I was ready to fight, but I didn't want to. So that's an example of how this physiological response can be an effective defense mechanism in terms of self-preservation. But unfortunately, overexposure to these hormones can negatively impact our physical and mental functioning. So ideally, we experience a stress response, the threat is removed, and everything, all the stress hormones go away and the effects of them, and our body returns to normal. But here's some examples of what might happen if you're feeling more stress in the workplace. So this is chronic stress. Chronic stress can impact all of us, and if we don't properly manage it, it can kind of have a snowball effect where it just keeps getting worse and causing all kinds of problems for us. So the hormones that are released when we experience a stress response cause our brain to be more alert, and overexposure can lead to headaches, memory problems, disrupted sleep, anxiety, and depression. Persistently elevated blood pressure can cause the heart to weaken and increase the potential for blood clotting, stroke, and heart attacks. And stress hormones can actually cause weight gain because they slow down the digestive system and cause an increase in production of fatty cells. Our immune system is also suppressed as a result of stress, which can lead to increased susceptibility to illness or infections. Stress is also known to trigger or exacerbate pre-existing conditions like chronic pain, psoriasis, irritable bowel syndrome, and diabetes. It can also cause or exacerbate mental illness. Some of the most common mental disorders associated with chronic stress are depression, anxiety, post-traumatic stress disorder, and even impulse control disorders. So a lot, if not all, of the kids we work with in OJA are likely to have experienced chronic stress already in a way of maybe harsh or inconsistent or neglectful parenting practices from their parents. And working with these adolescents who find themselves in the juvenile justice system prevents a variety of challenges for us as a work environment. We work with these kids who have well-developed defense mechanisms that involve unwillingness and even inability to trust other people, which makes it particularly difficult to work with them. Working to break down these walls or ensuring that these kids are getting what they need can take a toll on our physical and mental well-being. If you're not doing the things you should or could to take care of yourself, the chances are you're increasing your mental load, which can build up over time and lead to the experience of a chronic stress response, which may also lead to symptoms of burnout. Burnout is identified as an occupational phenomenon by the International Classification of Diseases. According to the ICD, International Classification of Diseases, burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It's characterized by 3 dimensions: feelings of energy, depletion, or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. Considering that some of us, especially during COVID, have maybe some extra time on our hands to be working from home, it might be a good time for us to address some of these symptoms that we might be experiencing. So how are we going to address it? There are tools for measuring burnout. The leading tool for measuring it was developed by Christina Maslach and some of her colleagues. The tool is known as the Maslach Burnout Inventory. There are a few different versions of this test that are for use in different professions. Like some examples include medical personnel, human service workers, even students in school, customer service workers, maintenance, stuff like that. But each of the different versions of the form assess and validate the 3-dimensional structures of burnout that were outlined by the International Classification of Diseases. So the exhaustion scale measures feelings of being overextended and exhausted by your work, while the cynicism scale measures an indifference or distant attitude towards your work. And the professional efficacy scale measures satisfaction with past and present accomplishments, and it explicitly assesses an individual's expectations of continued effectiveness at work. So unfortunately, I don't have access to this inventory, but there's a burnout test on mimetools.com. It seems to be somewhat similar, and it's not as well known or empirically based, but it could be useful for you. It's a series of 15 questions, takes approximately 5 to 10 minutes to complete. And after you choose to calculate your total, it'll ask for an email to save your results, but you don't have to do that. You just say no thanks, close the window at the bottom. And like I said, while it's not validated, like the Maslach burnout inventory, it can be helpful in recognizing symptoms of burnout that you may be experiencing. And there's also other information that may help in developing a plan to combat symptoms of burnout or developing self-care practices. So obviously there's a lot of concern surrounding the impact on physical and mental functioning. So just take a second to step back and think about your self-care practices. What is it that you do to take care of yourself? So some common responses that I would usually get are exercise or reading, baking, alone time, going to a salon, getting my nails done, something like that. And while some of these may be considered an effective form of self-care, some may actually be self-indulgent. So what's the difference? According to the Oxford Dictionary, the definition of self-care is the practice of taking an active role in protecting one's own well-being and happiness. Keyword there, or words, active role. Self-indulgence, the definition for that is the quality of being self-indulgent, and since that's not helpful at all, the definition of indulge is allow oneself to enjoy the pleasure of. So keep in mind that self-indulgence and self-care can overlap. The real difference is that self-indulgence does not require that you are actively attending to the situation and may not necessarily be protecting your well-being and happiness. A critical factor in how you engage in self-care is how you approach the activity. So getting a mani-pedi or a massage may seem self-indulgent, but if you choose to be present in the moment and take active notice of the benefits to your body, instead of scrolling through social media, this type of activity could actually be considered self-care. If activities like this become more of a distraction or a responsibility that you hold yourself to, then it takes away from the focus on well-being. I'm not saying there's anything wrong with regularly getting your nails done or going for a massage. I'm just saying that if you do, odds are you could probably benefit from developing some additional self-care practices. Just to give you a fun little example of how habitual activities aren't as effective for self-care, there have been studies done regarding the impact of swearing on pain reduction. And the research suggests that if you were to experience some type of pain, like stubbing your toe or skinning your knee, using expletives may actually reduce your experience of physical pain. However, it seems to be less effective for people who swear more often in general. So basically, if it becomes something you believe you need or you're too comfortable while doing it, the activity has surpassed self-care and become more of a distraction. So no, binge watching Tiger King, or any other hit series for that matter, is not an effective form of self-care, but it's a good example of self-indulgence. And as I said before, self-care and self-indulgence can overlap, and sometimes distractions are useful, especially if you're not quite ready to process a stressful experience. But if you continue to distract yourself from daily stressors, you are more likely to develop the mental and physiological difficulties that are associated with chronic stress and burnout. So, integrating self-care practices means using a holistic approach. We need to take care of ourselves physically and mentally. So, getting enough sleep, maintaining a steady, balanced diet, and staying active are foundations of physical well-being and even factor into our mental health. And we've already gone over how our body responds to mental stressors, and we can see that physical and mental well-being are unified, with each one affecting the other. I know eating right and exercising and getting a good night's rest is sometimes easier said than done, and we should avoid turning these things into a chore, but just making an active effort to adjust your habits slightly day by day can have a positive impact on our mental functioning. As for increasing our mental wellness, we should aim to be aware of the stresses in our lives, the impact they have on us, and strategies for maintaining that stress effectively. Current research suggests that the most effective form of self-care is mindfulness. So that is defined as a process of openly attending with awareness to one's experience in the moment. And there is a good quote here from Dr. Alyssa Appel from the University of California, San Francisco. She does a really good job of describing a mindful approach to managing stress, saying, "One thing to remember about chronic stress is that it's only our thoughts that make it seem so. Viewed mindfully, no situation is truly chronic. There are always calm moments to notice and be present for, moments that can be lived in with ease." Mindfulness interventions are often used in therapy because they're particularly effective in preventing or treating chronic stress or burnout. And research is suggesting that mindfulness training and interventions can actually train our brains to increase activity in the areas that regulate stress and decrease activity in the areas that are reactive to stress. So how are researchers training our brains to do this? Dr. J. David Creswell has done a lot of work in this area recently, and his studies suggest that there are two primary principles of mindfulness intervention, which include use of attention to monitor present moment experiences and adopting an orientation of acceptance towards these experiences. The idea of acceptance is noted as a critical factor in Dr. Creswell's work, as he states it's essential for regulating emotions and developing the capacity to be less reactive to stressful experiences. The research says that mindfulness interventions can improve chronic pain, and they may also improve some stress-related health problems, such as psoriasis, and irritable bowel syndrome, and diabetes. Implementing self-care practices is likely to look different for each of us, as we all have our own individual interests, which are often based on our own innate skills and life experiences. These personal interests can play a large role in developing self-care practices. So I wanted to share a brief overview of my self-care journey with you. When I was a kid, I absolutely loved anything that involved being active. Jumping on the trampoline, gymnastics, playing organized and recreational sports. I lived for it. I was in a really small town where I grew up, and I even remember running to my granny's house for fun while my parents drove behind me. As I got older, I developed a passion for basketball. That was my favorite thing. I played anytime I was able to. I loved the sport, and I even enjoyed the practices and running most of the time. But the way I felt during games is almost indescribable. I felt challenged but capable. My family would often ask if I heard them cheering for me. Sometimes I did hear them, but more often I forgot there was even an audience present. I was completely immersed in what I was doing in the present moment. It wasn't until my second year of working towards a bachelor's degree in college that I found out there was a name for that experience, which is flow. The concept of flow was defined by this guy, popularized by this guy. I'm not going to try to say his name because I can't. He described flow as being completely involved in an activity for its own sake. The ego falls away, time flies. Every action, movement, and thought follows inevitable from the previous one, like playing jazz. Your whole being is involved, and you're using your skills to the utmost. A simpler way, maybe, to describe flow is just total involvement in an activity that challenges you, all the while knowing that you have the ability to complete the task. When I was working on this presentation, I was talking about this a lot. I told my husband all about flow, and I asked him what kind of activities gave him this sort of experience. And he said, working on his car and cooking. And that really surprised me. I was like, that's so simple. And it wasn't until after he said that I realized that I can have this kind of experience from everyday activities as well. I don't have to play a basketball game to actually be aware of my present experiences. It's just a matter of being mindful about it and enjoying it, paying attention to it. So some ways we can practice this are mindful meditation. which is the most attainable and therefore effective form of self-care. I hope that I haven't lost any of you. I know that meditation can be kind of like a magical idea for some people, but keep in mind, I'm not asking anyone to sit cross-legged on the floor for an hour while chanting Om. You certainly can if that's what works for you, but mindfulness practice is not a one-size-fits-all kind of thing. Remember, all it takes is being attentive to what is happening in the present, which may involve directing your awareness to your breath, thoughts, physical sensations in your body, and how you're thinking and feeling about them. And also accepting these experiences. So this idea of acceptance is, it may be helpful to simply recognize the feelings and sensations you're experiencing without judgment. So instead of responding to what you're feeling, just make a note of it and choose to let it go. For those of you who have done yoga, it's a really good example of mindful meditation when it's done correctly. Maintaining focus on controlling your breathing and holding your muscles in such a way to achieve a specific pose holds your attention on what you're experiencing at that exact moment. A couple of years ago, I would have called yoga glorified stretching, but I've come to really enjoy the physical and mental challenges and the benefits. If you're not into yoga, there are a lot of other things you can try or you can do to increase your mindfulness. So let's just try a quick exercise right now that may be a useful form of daily self-care. So I'm going to give you about a minute to close your eyes and attempt to maintain awareness of the sensation of breathing through your nostrils. Okay, we're going to go ahead and call that time. I'm really not sure. I wasn't timing it if that was a minute or not. But were any of you able to maintain a complete focus on the sensation of breathing through your nostrils? It's more likely that your thoughts drifted, whether it was about controlling your breathing in some way or what you're going to make for dinner tonight. Attending to your here now experiences is likely a very different experience for most of us. And when we allow our minds to wander, which is suggested to cause a negative impact on our mental well-being. So this exercise is actually one of the more difficult mindful meditation practices because it requires you to focus on such a basic task. So let's try one more just real quick. Get into a comfortable, preferably seated position and close your eyes. Take a deep breath. Now begin to take notice of everything you can feel. The texture of the floor on your feet, and maybe the temperature of your feet if you're wearing shoes, your body pressing against the chair. What do you feel with your hands? Exercises like this can be adapted based on your personal preferences. You may ask yourself things, what can you smell, taste, hear, etc. Anything you can think of that may help ground you in your present experience. Exercises like this can be helpful for bringing your attention to the here and now and are particularly effective if you make an effort to mindfully say to yourself, I feel the carpet on my feet, or I smell my shampoo, or I hear the air conditioner. This could be practiced as a relaxation technique, like when you're trying to work but keep getting distracted. A brief mental break to ground yourself in your current situation can be very helpful when you're having trouble focusing. I don't have video right now, but I made a meditation jar, which has really helped me with this, with my distractions. Basically what it is, you just get a mason jar and put in some water, glue, and glitter. And depending on how much glue you put in there, it takes longer, but you shake the jar and the glitter and it all mixes up, and then it slowly starts to settle. So it could be a useful tool for you, and even to use with like working with kids. It's very useful. Just shake the jar and wait till it settles and try to be mindful of your present situation while you're watching it. There are a lot of ways like that you can implement self-care practices. The aim of this training was to help you identify ways that you can be proactive and take your mental and physical well-being into your own hands by learning about yourself and your interests, and finding a way to integrate a self-care practice into your daily life. For those of you who are interested in practicing mindful meditation, research indicating the use of online tools for mindfulness have been effective in improving mental health functioning. So there are so many different smartphone apps that you can use to help you with developing self-care practices. Here are some of the most popular ones. The Calm app was actually used in a study recently to measure the effects of mindfulness meditation on the amount of stress that college students experience. And the findings suggested the Calm app was effective. I downloaded all of these apps and I played with them a little bit, and so far I would say that the Calm app was my favorite. The 7 days of calm guided meditations are pretty relaxing, and I also like that you have some personalization options that you can choose between a male and a female voice, and like the male and female voice to guide your practice. And I think there are a few different classes, I guess you'd call it, that you can use. I really like Mood Path at first. It asks you a series of questions every morning, afternoon, and evening for 2 weeks. And I was only about a week in on this app, and it had already, after 3 days, it had sent me a notification to let me know that I was experiencing symptoms of depression, which didn't seem appropriate to me to throw a mental health disorder out there so quickly. But so be warned if you try that one. These apps may not be for everyone, but if you're interested in using one to help you stay on track with self-care practices, I'd recommend trying one at a time because they all have a free 1-week trial for their premium service. And the free versions are pretty limited. The Calm app's free version isn't too bad. There are also lots of videos on YouTube that you could use that anyone can access just by searching for guided meditation or guided relaxation. Things like that. Guided imagery is a really good one too to look up on YouTube. And those are very relaxing. I'm not saying that actively practicing meditation is the only way to be mindful. Anything that holds your attention in the present moment is an effective form of self-care. And some may find this in journaling, fishing, or drawing, or crafting. The main takeaway is that it's not the activity, it's the process, and being actively present for it. If you find your mind is wandering more than usual, maybe try to use a mindful meditation strategy like the ones we did just during this presentation. Self-care can essentially be anything you want it to be. The best way to ensure that you're going to actually use self-care is by personalizing it. Think of something you enjoy. Make an effort to do it often and without distractions. I'm really into the yoga aspect of it, so I recommend that any of you out there willing to try it. And that's it. Thank you for joining the training. Here is my information again. Anybody, if you have any questions or comments, or anything like that, please feel free to email me. The email's right there at the bottom on the right corner. And thank you so much.